we're talking about internet type things. Is that what we're talking about?
I'm intimidated by the technology. I really am.
Well, I think it's fine, except I just don't use it. Probably because I don't know how.
They're not familiar with electronic medical records as much, doing the chart updates and stuff, and on the computer, let alone on an iPad, which kind of takes it to a different level. And I've been a patient, and whereas I thought it was great, it was kind of weird having my doctor in the living room with me.
There was lots of barriers to bringing in older adults, as well as parking and all these other considerations to bringing them on site, on campus. So even before COVID, I was pushing to have telehealth be incorporated into the class. The idea was we'd do it with 1 or 2 patients. COVID happened, we flipped all 125 community health managers to do telehealth.
I do think it's a good opportunity because I think there are a lot of times that we have to go for follow-up appointments, especially older adults. And I don't know that they have to be in person. A lot of times it's just talking, and I think that telehealth just fits the bill. And they can see the client, see if there are any obvious changes, and talk to them. And if they need to, then the person can come in.
You do all that stuff for me. If you didn't do it, I probably wouldn't do it. I'd be dead because I wouldn't be seeing all those doctors.
My chart, most of all, just gives you results of a test, blood test and stuff. I like to talk to individuals.
Getting closer to that older adult stage of my life. And one thing I think is really helpful is if I have a question for my doctor, I can just go into my chart and do the question. And it makes med refills much easier as well.
I have a cane. I have my shower chair. I have grab bars in my bathroom.
Mm-hmm.
I have leads for my dog at the door. And I think that's it.
About a third of them say they're not confident to use technology nor the internet. If they were, they'd need significant training. About a third of them reflect that. And then about 20% of them say, I'm too old to learn the technology. That's the quoted words.
I feel like I can almost know right away when I'm presenting a device to somebody if it's going to be successful, just like based on their reaction. If they react and they're like, oh, I don't know about this. This has too many buttons. It's not a great sign. But if they're like, oh, I can see how this can be really helpful, then, I think there's a little bit more leeway that it might be successful.
Because they don't really understand that a lot of people still don't use their phone or computer at this age.
There's socioeconomic disparities. There's racial and ethnic disparities, and disparities by age group. So we're noticing in-group differences, even among the subset of older adults. And so targeting that.
So some of the benefits, when I think about some older adults on the west side of the city, that they're from low socioeconomic backgrounds and they do not have the resources to make modifications to their homes. Many have steps going up to their homes, and so they can't get out easily to go to doctor's appointments. And so Rush Primary Care at Home has either been doing home visits or they've been doing telehealth visits. And I think that is really a benefit because it keeps people connected to their healthcare provider.
I mean, overall, it's accessibility. And, first and foremost, it's you think of, and rightfully, physical accessibility. Being able to access healthcare services in the home is phenomenal. But also barriers to, there's just a limited number of providers, so it can address geographic barriers. But also, in the OT, I'm like, it can also reduce barriers caused by any number of conditions or disabilities, ensuring that all ethnicities, cultures have equal and accessible access to services. I see telehealth as being able to meet that need too. In our sample, we identified that older adults who previously felt a lack of confidence gained confidence by both training and doing. So that's important to know.
In acute care, I think our biggest barriers are time and resources. We don't spend that much time, each day with a client or with a patient. And so our use with assistive technology with them is kind of limited to that snapshot in time of when we are working with them.
I think that we can provide, we can break down the tasks more and can provide step-by-step instructions. I think if we could do home visits with people, then we could walk them through and again, do step-by-step instruction, have screenshots up so that people have visual cues.
Training providers how to, with parallel learning objectives to meet the needs of telehealth, because it's not the same as in person. It can be in many regards as effective and reduce a lot of barriers to access to healthcare, but it's not the same learning. It's not the same exact process.
Right. I think it's a really big barrier for older adults or the aging population to use assistive technology is like their ability to troubleshoot. So like we can go through all those steps, but if something goes differently, then that's like a whole new learning step that they have to kind of overcome.
They don't call back, or she'll have to repeat the call, and it's very difficult for a lot of people.
So I do think there's advanced training, but I think we're at a time where we're able to leverage that to really be a profession that embraces it as opposed to is kind of aversive to it. We're some of the best suited providers of telehealth services to meet those needs, and it can really be something we can leverage to the benefit of our clients.
I think it also adds a really cool aspect to OT because if we're doing we can do a home visit over telehealth. They can take us around their home and we can see some of the issues.
I think that we really need to continue to advocate for the use of assistive technology, and especially in like other settings. I think acute care could use some encouragement of like the use of technology and kind of figuring out those financial barriers to get, people to be able to use these devices successfully to really improve their quality of life and improve their, ability to function independently in society.
With change comes fear of that change and avoidance. And so I think as OT, it really opens up avenues more for our profession than a lot of our allied health. It's difficult for physical therapists to sometimes translate their services, whereas OT, our scope of practice, can really embrace what telehealth can allow. But even with the Oculus, or Meta as it's now called, you can feel like you're physically present and have the full visualization of the client as if they're right in front of you. Those are emerging technologies, but in 5 years, it's going to be pretty pervasive. So how will that influence our interactions with older adults?
Technology doesn't need to be scary. We have a unique opportunity to lead our aging population into this new world of healthcare by listening, adapting, and doing.
That it?
Yeah.
Well, that was pretty easy.
So that's how I feel about that. Anything else?